All right, welcome everyone to our first Unidos US affiliate series focused on HIV positive sensitivity.
Hi, welcome everyone. I'm just going to say a few words on behalf of Unidos. Thank you for joining us. If you're not joining us, thank you for watching this recording. We'll have other sessions coming up in additional months. We know that the heart of the Unidos US is the affiliate network. We rely on our affiliates to provide expertise and leadership where they fit best. So it was our pleasure to elevate AAMA's goal of providing this webinar series exclusive to fellow affiliates. Because of the nature of the work that we do, we cannot focus on all issues at all times, but they do not cease to be important. And it does not mean that there are not ways in which they intersect with our work. These sessions are an excellent example on how affiliates can help their peers scale by relying on each other for resources and understanding. I can provide a brief Spanish translation for those of you that may be watching. En el Centro de Unidos US están nuestros afiliados. Nosotros dependemos sobre el apoyo de nuestros afiliados y el conocimiento sobre temas en donde ellos son los líderes. Gracias a AAMA por dedicar esta presentación exclusiva para nuestros afiliados sobre la VIH. Esta serie es ejemplar de cómo afiliados pueden apoyarse a cada uno, se pueden apoyar a cada uno para mejorar los servicios sobre nuestras comunicaciones o comunidades.
Bienvenidos a todos a nuestra primera serie de afiliados de Unidos en Estados Unidos, centrada en personas sensibles al VIH.
Thank you, Aida. Thank you, Laura. So let me start off by introducing myself. My name is Adriana De Bello. I'm the program manager of the Minorities Action Programs, and I joined the AAMA family in 2006. With me today is Laura Garcia, our family prevention specialist, who will be translating throughout the presentation in Spanish, and Francisco Bernal, our prevention specialist, who will be presenting in English.
Mi nombre es Adriana Di Bello, gerente de los programas de acción para las minorías MAP, y me uní a la familia de AAMA en el año 2006. Conmigo está Laura García, es nuestra especialista en prevención familiar que estará presentando durante la presentación en español. Y tenemos a Francisco Bernal, que estará presentando en inglés durante la presentación y es nuestro especialista en prevención.
With that said, these webinars are presented by AAMA's Prevention and Counseling Minorities Action Program staff. We have 4 more scheduled virtual webinars, one each month through August, and we certainly hope that you are all able to attend. We also ask that you invite others to attend by sharing our registration link located at our AAMA website.
Dicho esto, estos seminarios web son presentados por el personal del Programa de Acción para Minorías y Prevención y Consejería de AAMA. Tenemos 4 seminarios web virtuales para programados, uno cada mes hasta agosto, y ciertamente esperamos que puedan asistir a todos e invitar a otros a participar compartiendo el enlace de registro que se encuentra en nuestro sitio web de AAMA.
Wonderful. So just some housekeeping rules. Remember that this webinar will be recorded. We ask that you mute yourself today until we get to our question and answer portion. If you have any questions, and we ask that you hold your questions until the end during that Q&A portion. Or if there's any burning questions, you want to go ahead and type them in to the chat box. Feel free to do so, and we will be monitoring the questions and comments as they come through.
Solo un recordatorio, silenciaremos a todos los participantes en el seminario web de hoy. Le pedimos si puede mantener sus preguntas hasta el final en nuestra sección de preguntas y respuestas, o si hay alguna pregunta al momento, no dude en escribirla en el cuadro de chat y estaré monitoreando las preguntas y los comentarios.
Now, if each of you would please introduce yourself in the chat box now by typing your full name, your organization, company, and what brings you to today's session.
Si cada uno de ustedes quisiera presentarse en el cuadro de chat ahora, escribiendo su nombre completo, su organización, empresa y lo que lo trae a nuestra sesión de hoy.
I also want to give a quick reminder, if you need to step away for a quick second, please don't forget to turn off your camera and ensure that you're on mute just to protect your privacy. And reminder that this is really a safe space that we want to create for everyone. So we ask that you all be polite and respectful with comments and questions.
Un recordatorio rápido, si necesita alejarse por unos segundos, apague la cámara y asegúrese de estar en silencio para proteger su privacidad. Además, un último recordatorio amistoso para todos. Este es un espacio seguro, por eso queremos que todos sean educados y respetuosos a los que están participando.
Great. So I am transitioning over to Francisco. Well, he will begin the presentation.
Okay. Sorry, my computer kind of froze here.
Okay. So now I'd like to start off by sharing a little bit about AAMA's history. And apologize for the delay there. So AAMA was founded in 1970 as the Association for Advancement of Mexican Americans by a group of Latino business leaders who were concerned about problems of high school dropouts and teens who were involved in substance use in the Houston's East End area.
Ahora me gustaría comenzar compartiendo un poco de historia de cómo empezó AAMA. AAMA fue fundada en 1970 como la Asociación para el Avance de los México Estadounidenses por un grupo de líderes empresariales latinos que estaban preocupados por los problemas de los que abandonan la escuela secundaria y el uso de sustancias entre los adolescentes del lado este de Houston.
Now, today's AAMA's programs help individuals and families address some of the most prevalent barriers to their success and prepare for full potential and participation in our current communities. This year, AAMA is celebrating our 50th anniversary serving the Houston community. And we'd like for you to see a short clip of what AAMA is today.
Los programas de AAMA ayudan a las personas y las familias a abordar algunas de las barreras más frecuentes para su éxito y a prepararse para la plena participación en sus comunidades. Este año, AAMA celebra nuestro 50 aniversario al servicio de la comunidad de Houston. Y aquí vamos a presentarles un video para resaltar a AAMA ahora.
Our focus at AAMA is on our families and our community. Strong families and strong communities is at the heart of what we do at AAMA every day.
AAMA's Georgia Sanchez Charter School serves students in Southeast and Northside Houston in grades 6 through 12. We meet students where they are despite their academic and social emotional barriers. Our small and safe school environment allows teachers to provide students the individualized attention many of them need in order to succeed. We support our families and community on a path towards self-actualization through AAMA's integrated services.
Our vision at AAMA is a community of individuals who have achieved security, self-actualization, and well-being.
AAMA Adelante prepares adults to enter or advance in the workforce by providing classes to help them improve their English language skills or to complete a secondary school credential such as a GED, and to help them identify and qualify for skills training in the most high-wage, high-demand career pathways, such as the medical field or in manufacturing. Our goal is to ensure that our adult students attain financial security for their families and become successful participants in their community and in the city's prosperity.
Our unique strength at AAMA is our integrated holistic approach in education, workforce readiness, and health.
AAMA's Prevention and Counseling Division strives to help each client reach their own personal well-being. We do this by treating substance abuse disorders as any other medical disease, addressing social determinants that negatively impact our clients with communicable diseases, especially those who are HIV positive.
I've seen this video multiple times and it always inspires me and really honestly empowers me doing the work that I do all the time. And it just really reminds me of the reasons why I love working at AAMA. I think Laura, you're on mute. There we go.
Para mí, cada vez que veo este video, siempre es una inspiración y un empoderamiento ver cómo hemos realizado en esta compañía y cómo hemos crecido al momento.
Thank you. Next slide. So today's focus will be on our prevention programs that are located here in Houston, Texas. However, I do want to bring up some highlights on Laredo. Our Laredo location does mirror some of our services here in Houston. They actually have, and just really highlighting on Laredo is that they have an outstanding accredited methadone clinic that just honestly goes above and beyond to serve that Laredo community. So I just always want to give them a shout out because even during the COVID, the pandemic, they were working full force. So.
Actualmente estamos en Laredo y Houston, Texas, pero el enfoque de hoy está en nuestros servicios de Houston. Sin embargo, nuestra ubicación en Laredo refleja mucho de nuestros servicios en Houston, con la excepción de que Laredo también tiene una clínica de metadona acreditada.
So through our prevention and counseling services here at AAMA, we are one of the largest providers of alcohol and substance use prevention and treatment in the state of Texas. Our programs help individuals break the cycle of addiction and change the path of their lives. These include prevention education, substance abuse treatment services, outreach health education, testing and referrals for adults who are at high risk of communicable infections.
Dentro de los programas de prevención y asesoramiento de AAMA en Texas, a través de nuestros servicios de prevención y asesoramiento, AAMA es uno de los mayores proveedores de prevención y tratamiento del consumo de alcohol y sustancias en Texas. Nuestros programas ayudan a las personas a romper el ciclo de adicción y a cambiar la trayectoria de sus vidas, y esto incluye educación preventiva, servicios de tratamiento por abuso de sustancias, difusión de la educación sanitaria y pruebas y derivaciones para adultos con alto riesgo de contraer infecciones contagiosas.
All right. The Minorities Action Program, also known as MAP, just in case in future reference, we might mention MAP. We are talking about the Minorities Action Program. So our services are provided both in English and Spanish. We have free HIV, syphilis, and hepatitis C testing. We also do intensive outpatient treatments, supportive services, such as referral linkages to housing assistance, food pantries, HIV-specific medical care, and more. And we also do support groups and education workshops.
Aquí en el programa MAP, los servicios se brindan en inglés y en español, pruebas gratuitas del VIH, sífilis y hepatitis C, tratamientos intensivos, ambulatorios y servicios de apoyo, enlaces de remisión, asistencia de vivienda y despensas de alimentos, atención médica específica para el VIH y más, grupos de apoyo y talleres educativos.
Okay, so this slide, it gives you a visual of each of the funding sources that the program receives, right? So creating a continuum of care for all that are coming through our minority action programs. And the main efforts are focused on HIV, hepatitis C, STDs, alcohol, tobacco, other drugs, and behavioral health. In order to serve the entire community, there must be several funding sources.
Esta página les brinda una imagen visual de cada una de las fuentes de financiamiento que recibe el programa, creando un continuo de atención para todos los que vienen a través de nuestros programas de acción para las minorías. Los principales esfuerzos se centran en el VIH, la hepatitis C, las ITS, el alcohol, el tabaco y otras drogas, y la salud del comportamiento. Para servir toda la comunidad debe haber varias fuentes de financiamiento.
So SAMHSA, which stands for Substance Abuse and Mental Health Service Administration, they actually fund two of our programs. So we have Center for Substance Abuse Prevention, also known as CSAP. We have Center for Substance Abuse Treatment, known as CSAT.
Bajo SAMHSA, que son los servicios de administración en abuso de sustancias y salud mental, tenemos Centro de Tratamiento de Abuso de Sustancias y Centro de Prevención de Abuso de Sustancias.
All right, so our CSAP funded program, this is a family prevention program that focuses on the onset and reduction of the progression of underage drinking and reduces drinking and marijuana use and its related problems. And our target ages are 9 to 20, residing in the Houston area. Our certified prevention specialists, which are Laura and I, we educate the family about the dangers of drugs, alcohol, tobacco, gang involvement, and more.
El programa financiado por SAMHSA, que es CSAP de prevención. Este programa de prevención familiar se centró en la aparición y reducción del progreso del consumo de alcohol por menores y en reducir el consumo de alcohol y marihuana y sus problemas relacionados. Dirigido a las edades de 9 a 20 años que residen en el área de Houston. Nuestros especialistas de prevención certificados, Francisco Bernal y su servidora, educan a la familia sobre el peligro de las drogas, el alcohol, el tabaco y la participación en pandillas y más.
Okay, so basically the program introduces the families to evidence-based intervention and more, such as Familia Adelante and Towards No Drugs, family and youth support groups, and community activities. Participants of the program develop skills in decision-making, emotional management, effective communication skills, peer pressure refusal, pro-social bonding, and conflict resolution.
El programa de SAMHSA, CSAP, fundado, este programa presenta a las familias intervenciones basadas en evidencia y más, como Familia Adelante y Towards No Drugs, grupos de apoyo para familias y jóvenes, actividades comunitarias, Los participantes del programa desarrollarán habilidades en la toma de decisiones, manejo emocional, habilidades de comunicación efectiva, rechazo a la presión de los compañeros y vínculos prosociales y habilidades de resolución de conflictos.
All right, so now our SAMHSA CSAT funded program. Our CSAT services allows us to increase engagement and care by expanding treatment services among minority men who identify having sex with men, minority transgender persons, and high-risk minority heterosexuals. Houston is located in Harris County and is the most populous city in Texas and the fourth most populous city in the US with an estimated population of 2.3 million, according to the Census Bureau 2019. Our program incorporates a trauma-informed care model, recovery support services by trained staff, personalized cognitive counseling, and antiretroviral treatment and access to services to its service delivery model. And it also enhances services by providing HIV education, testing, risk reduction, and linkage to care.
Los servicios de CSAT, del Programa de Acción para las Minorías, MAP, de AAMA, nos permitieron aumentar la participación de la atención al expandir los servicios de tratamiento entre los hombres de minoría que identifican tener sexo con hombres, las personas transgénero y minorías y los heterosexuales de minorías de alto riesgo. Houston se encuentra en el condado de Harris y es la ciudad más poblada de Texas y la cuarta ciudad más poblada de los Estados Unidos, con una población estimada de 2.31 millón, y esto es basado en el censo del 2019. Nuestros programas incorporan un modelo de atención con información sobre el trauma, servicios de apoyo para la recuperación por parte de personal capacitado en SOAR, SSI y SSDI, Outreach, Access and Recovery. Asesoramiento cognitivo personalizado con el PCC y tratamiento antirretroviral y acceso de los servicios, ARTAS, para su modelo de presentación de servicio. Mejorar los servicios proporcionados, educación sobre el VIH, pruebas de reducción y de riesgos y vinculación con la atención.
So our services offer, like we mentioned, we have HIV screening, education and management, hepatitis B and C screening, and referral, substance use counseling with a licensed chemical dependency counselor, co-occurring mental health disorder screening and counseling services, and risk and harm reduction education.
Programas financiados por SAMHSA, CSAT, servicios ofrecidos son detección, educación y manejo del VIH, detección y derivación de hepatitis B y C, asesoramiento sobre el uso de sustancias con un consejero de dependencias de sustancias químicas con licencia, que es un LCDC, y servicios de asesoramiento, exámenes de detección de trastornos de salud mental concurrentes, educación sobre reducción de riesgos y daños.
So through our Healthy Kids, Healthy Families, provided by the Blue Cross Blue Shield of Texas, it's a grant that allows us to emphasize and enhance services with a focus on addressing social factors that affect health outcomes such as nutrition, access to healthcare, promoting safe environment, transportation, and housing.
Bajo la patrocinación de Blue Cross Blue Shield de Texas, tenemos niños saludables, familias saludables, y es una subvención que nos permite enfatizar y mejorar los servicios con un enfoque en abordar los factores sociales que afectan los resultados de salud, tales como nutrición, acceso a la asistencia sanitaria, promoción de entornos seguros, transporte y vivienda.
So through the Texas Health and Human Services, we also have HIV Prevention Core and client-funded services.
Aquí tenemos servicios básicos de prevención del VIH y financiados por el cliente.
So the program's objective is to meet clients where they are and offer help. The program also strongly believes in harm risk reduction and how it will provide the essential tools for individuals to gradually work towards being safer. What the program offers is HIV, syphilis, and hepatitis C testing and education. The clients get to work individually with an outreach specialist to help connect them to the best services to meet their needs.
¿Cuál es el objetivo en este programa? El objetivo del programa HIV Core y al cliente es conocer a cada cliente en su situación y ofrece ayuda. El programa cree firmemente en la reducción de daños y proporcionará las herramientas esenciales para trabajar gradualmente. ¿Cómo se estructura el núcleo y el cliente del VIH? Hacia estar más seguro. ¿Qué ofrece este programa? El programa ofrece pruebas de VIH, sífilis, hepatitis C. Los clientes pueden trabajar individualmente con un especialista en extensión para ayudar a adaptar las necesidades del cliente y conectarlo con los mejores servicios para sus necesidades.
How is HIV core and client structured? Well, the program provides evidence-based interventions approved by the Center of Disease Control and Prevention, also known as the CDC. We have Many Man, Many Voice program, which focuses on better preparing for and building confidence in using condoms in daily life. And we also have another program called Y Ahora Qué. It is a grassroots intervention which helps newly diagnosed individuals come together to build strong bonds while learning the steps of how to stay healthy.
¿Cómo se estructura el núcleo y el cliente del VIH? El programa proporciona intervenciones basadas en evidencia probadas por el CDC y programas. Many Men, Many Voices, que se enfoca en una mejor preparación y en generar confianza en el uso de condones en la vida diaria. Otro programa que tenemos también es ¿Y ahora qué? Que ayuda a las personas recién diagnosticadas a unirse para construir vínculos fuertes mientras aprenden los pasos para mantenerse saludables.
So we also provide case management through Ryan White and HOPWA Supportive Services. So Ryan White is a HIV/AIDS program under the Health Resource and Service Administration, and it provides comprehensive system of HIV primary medical care, essential support services, and medications for low-income people with HIV. The program funds grants to states, cities, counties, and local community-based organizations to provide care and treatment services to people with HIV to improve health outcomes and reduce HIV transmission among hard-to-reach populations. And HOPWA stands for Housing Opportunities for People with AIDS, and is the only federal program dedicated to addressing the housing needs of people living with HIV under the HOPWA program. U.S. Department of Housing and Urban Development makes grants to local communities, states, and nonprofit organizations for projects that benefit low-income people living with HIV and their families.
Bajo nuestro programa de Ryan White, es un programa de VIH y SIDA de la Administración de Recursos y Servicios de Salud, que ofrece un sistema integral de atención médica primaria para el VIH, servicios de apoyo esenciales y medicamentos para personas con VIH de bajos ingresos. El programa financia subvenciones a estados, ciudades, condados y organizaciones comunitarias locales para brindar servicios de atención y tratamiento a personas con VIH para mejorar los resultados de su salud y reducir la transmisión del VIH entre poblaciones de difícil acceso. Bajo este otro programa de HOPWA, que significa Oportunidades de Vivienda para Personas con SIDA, HOPWA son las siglas del Housing Opportunities for People with AIDS y es el único programa federal dedicado a abordar las necesidades de vivienda de las personas que viven con el VIH. En el marco del programa HOPWA, el Departamento de Vivienda y Desarrollo Urbano de los Estados Unidos, under HUD, otorga subvenciones a comunidades locales y a estados, organizaciones sin fino de lucro, para proyectos que benefician a personas de bajos ingresos y que viven con el VIH y a sus familias.
So the Ryan White funded program, the purpose of these funds is to provide non-medical case management to those persons living with HIV/AIDS who are also facing the challenges of substance use disorders, and to improve the quality, availability, and organization of healthcare and support services and the designated service delivery area of Houston and surrounding counties.
El propósito de estos fondos es proporcionar administración de cada casos no médicos a aquellas personas que viven con el VIH o el SIDA y enfrentan a los desafíos de los trastornos por uso de sustancias, mejorar la calidad, disponibilidad y organización de la atención médica y los servicios de apoyo en la prestación de servicios de VIH designada, área de Houston y los condados circundantes.
So HOPWA, which stands for Housing Opportunities of Persons with AIDS, to qualify for this program, you have to meet the definition of low income, have an HIV positive diagnosis, live in the Houston metropolitan statistical area, and for tenant-based rental assistance and community resources, must be at a 50% or below of the median income.
Bajo el programa de HAPWA, oportunidades de vivienda para personas con SIDA, servicios de administración de casos de apoyo HAPWA, el programa brinda asistencia de vivienda para personas que viven con el VIH/SIDA. Bajo esa criteria, tienen que cumplir con la definición de bajos ingresos para asistencia de alquiler basada en inquilinos, y los recursos comunitarios deben estar al menos 50% menos, tienen un diagnóstico del VIH positivo, viven en la AAMA de Houston, que es la estadística metropolitana elegible área, y sus principales ciudades.
Okay, so clients are considered eligible for HOPWA program if they reside in the sponsor's service region, they have received a medical diagnosis of HIV/AIDS as defined by the CDC, are homeless or at risk of homelessness, and the applicant's income does not exceed 80% of median family income for the county or residents as determined by HUD annually.
Las oportunidades de vivienda para personas con SIDA bajo el programa de HAPWA, servicios de administración de casos de apoyo de HAPWA. Los clientes se consideran elegibles para programas de HAPWA bajo si residen en la región de servicios del patrocinador, ha recibido un diagnóstico de médico del VIH/SIDA según el definido por los CDC. El solicitante no tiene hogar o está en riesgo de desamparo. Los riesgos del solicitante no superan el 80% del ingreso familiar medio para el condado o residencia según lo determinado por HUD anualmente.
And that brings us to question and answers. So that realize that was a lot of information for some to take in, while others may be familiar with some of those programs. But definitely want to take the time out to really answer any questions that you may have in reference to one of those grants or the partnerships, things of that nature. And by all means, we don't do it alone. We work very, very closely with a lot of the task forces, the coalitions, community planning groups. So there's a number of individuals that take part in, and even our volunteers. I have to say that a lot of times our volunteers are tend to sometimes even be, the change makers, right? And so I'll take any questions that you may have, and I'll take a peek at the chat box and see if anyone asked any questions. I don't believe so.
I have a question for either you or Francisco, whoever would like to respond. do you find, or maybe what are some of the challenges that you encounter doing this type of work? I know a lot of it, could be like community education, but are there any challenges that you can speak to that maybe can help other, some of our affiliates that are maybe thinking about jumping into offering programs like this, whether it's an internal challenge or a community challenge, if you can speak to anything?
So when we look at challenges, I think it's ultimately, depending on the area. I work with a lot of other organizations across the nation, and sometimes it's about community challenges that they're going through and trying to develop programs. Depending on what is priority, so a lot of the things is first steps are always needs assessments, trying to determine those community needs, developing those town halls, questioning, what type of programs are in existence and what are the gaps, so when establishing those programs. I'm not sure if I caught all of your question there.
You did for the most part. I'm always trying to think of what could be useful. For example, another program manager at another affiliate organization,
Absolutely.
starting a program like this, maybe things that could come up that they may perceive as a challenge, or maybe even just best practices on something that starting a program like this would entail. And I may have missed this in the presentation. How long have you been doing these offering these type of programs?
So I actually joined AAMA in 2006. AAMA actually had the Minorities Action Program in existence probably 15 years even before I came along, right? And one of the things that I admired about AAMA is that they always listened to what the community needs were. They didn't create anything without hearing firsthand what exactly were those needs. And then they went into a little bit more depth about, looking at structure and really finding the best practices. So a lot of times it's, you'll have these startup agencies and businesses that, just they come up with this idea and then they just run with it. Whereas there's a little bit more planning involved.
Yeah, I can only imagine. I'm sorry, I'm jumping in a little bit here, but I did want to make sure that as I'm as things come up, I'm asking them, just in case other folks may also have the same questions. Given that we were in a health pandemic, we've been in this health pandemic, for now over a year. Are there any, I'm sure that a lot of your programs adapted to that, but is there anything that changed, that you did completely differently now that maybe you're still doing, with the way that you offer these type of services?
So I think taking step backs, right, paying attention to where our community is, especially the age differences and what the knowledge base and what they have access to. So, recognizing that not everyone still today has computer or internet accessibility was a challenge for individuals going through the pandemic, right? Some people couldn't even pay their bills, utilities, or rent, much less get on, an internet provider. And so that became one of those challenges. But, we're very fortunate that we have those partnerships established. And I think that that's important, to really look at your partnerships and see that bigger picture. How is it those partnerships they're going to be able to help and support your community when a crisis such as this last year, right, comes into place, and how you know, we all can move together in that same direction of accomplishing those goals and those similar needs of getting great outcomes. I think the other thing was really putting in place some really good practices behind, you know, and of course you heard it over and over again, right? Everybody was talking about your social distancing, practicing, you know, good sanitation, hand washing, you know, face masks, you know, getting those things out there for the community. So we also jumped on that bandwagon of putting some of the promotional material that we have to offer, right? Getting hand sanitizer out there. When we do our food banks on we changed it up a little bit to where it was the drive-through. You know, people didn't have to come off their vehicles. It was just kind of a drive-by, and we'd place their meals and the food boxes into the trunk of their car, but also including literature and information about our program services and reminding them of, you know, what is available to them as a family, partnering up with other organizations when they're having their food banks, you know, allowing us to partner up with them and sharing our resources. So it just took a little extra, you know, even collaborating with other schools, and, you know, trying to help those counselors or educators, because everybody was kind of going through their own challenges, if you would, and just trying to find the best way to approach each situation as it came.
Was this all said?
Any other questions?
I have one question. I wanted to ask, what are some of the recommendations that AAMA has for affiliates that may not be ready to offer these programs, but want to be sensitive to either the stigma or the potential need that may exist in the community without, you know, knowing fully where the needs are?
So I think it's very important to really do some research, right? Find out where your community federally qualified health centers are, and talk with some of those health centers to find out what their services are, and what they're doing for individuals who are living with HIV or AIDS. You also want to look at community planning groups, and I would also recommend that they learn about the plan to end the epidemic of HIV. And there's these plans that are put in place by, and this is through CDC, HRSA. You have all of this information, and it's kind of like this roadmap, and what we call a roadmap to ending HIV, right? And so it really gives you this, the overall picture of how to approach certain situations and what are the recommendations, you know, going through some of those, maybe there's task forces that are already established, and talking to individuals who are actually living with HIV, to get their perspective on what those needs are and how they've been treated, and how maybe the challenges that they struggle with overcoming.
Thank you.
Any other questions? Okay, well, if there's no other questions, we just want to definitely remind you that We are available, and, we can answer additional questions at any other time. You're always welcome to come onto our website, and, or even go to our other social media platforms and follow us. Please do share our following webinar series. We hope that you can participate in the following ones to come. And if you have any additional questions, don't hesitate to contact one of our team members. Thank you very much. Y'all have a wonderful evening, or afternoon, I should say.
Y yo quiero mencionar, para obtener más información sobre AAMA, por favor visite nuestro sitio web en aama.org. Te invitamos a que te conectes con nosotros en las redes sociales, en los próximos talleres que tendremos cada mes, y con confianza, llámenos. Gracias.
And that concludes our webinar for today. Have a wonderful day.
Thank you, everyone.
Ujú.